The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HeathBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing ear, nose, and throat problems, and really how to address the lumps and bumps in this area.
Yes, Errol, these problems are certainly important ones that need to be addressed. And joining us this evening is Dr. David Jakubowicz, Chairman of Bronx Lebanon's Hospital Center Ear, Nose, and Throat Department, a widely acknowledged expert in the field. He is also a clinical assistant professor at the Albert Einstein College of Medicine. Welcome, David.
Now, before we hear from you, Dr. Jakubowicz, let me encourage you, our viewers, to once again call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now, let me begin the program, Dr. Jakubowicz, by asking you to share with our viewers the services that you and your department provide to the community.
We provide comprehensive ear, nose, and throat care for the community, which includes everything from basic hearing screenings to ear examinations to dealing with hearing loss, nasal problems, nasal polyposis, chronic rhinitis, allergies, voice issues, tonsil issues, throat issues, major head and neck cancer. And we also provide different services that we can do, including looking at the voice if you have a singer and you need stroboscopy, or if you have thyroid issues and you require a head and neck ultrasound, we also do it in our office. We provide comprehensive care that's friendly and affordable to meet the needs of the community.
And you're also involved with surgery as well, I guess, when the time comes.
The great thing about dealing with an ear, nose, and throat specialist is we take care of things medically, and when they require surgeon, the same person that was taking care of you is the same person you're meeting in the operating room to discuss things and to actually perform the surgery and make sure you have the best possible outcome.
Okay. Should an individual be concerned about a mass, a lump, or something new that grows in the neck? Tell us a little bit about that.
The way I like people to look at it is the following, is first you got to figure out how you're feeling. If you're feeling ill and a bump pops up and it's painful, it's tender, it's red, that's something you need to take care of a lot more immediately. That could be an infection or an abscess that develops. If you're feeling fine and a lump pops up, then you really have to consider about 6 weeks from there. Has it gone away? Has it gotten bigger? Does it move or not move? All these things as far as if the mass is getting bigger or it's not going away and it's fixed or doesn't move, or even if it does move, if it's still persistent, then you should see a doctor about that. But in the acute area, if you're feeling ill and something swells in your neck and it's red and tender, at that point you should also speak to a doctor earlier rather than later, because it may be an infection that requires an antibiotic that you may eventually avoid needing a surgical procedure to get that resolved.
Well, expanding on Dr. Gums' question and your answer, what are some of the normal glands that patients might consider problematic?
The thing is that people, every so often, they may feel ill and they may feel around their neck, which is why we're having this whole discussion, is to just talk about what's normal and what's not. Right. So when you end up going about it and you feel something new, sometimes we have older patients who come in and they feel underneath here. And they say, well, I didn't have that before, but it really can be the submandibular gland over there or one of the saliva or spit glands that are acting up over there, or just happen to be falling down a little bit more because gravity's taking an effect. But in the neck, well, the lymph nodes, there are 300 lymph nodes in the neck. These are basically the garbage collectors that anytime you get an infection, it goes to the lymph nodes, the body starts processing it, and there can be swellings all along through the neck, actually behind the neck and throughout the body that can swell in response to infections. Other things that can become enlarged are simply, frequently a lot of infections occur where there is hair-bearing skin. So what can happen is a hair follicle gets infected, that ends up causing an abscess or some type of problem related to that, and frequently acne is also related to that as well.
Well, you sort of answered my question already, but let's go over it again.
Yeah.
Lymph nodes are normal around the neck.
Yes, there are 300 lymph nodes, 150 on each side, all throughout the neck. Basically what they do is they serve to filter and let us to process those things that are foreign. Basically, if an infection comes into the body, it's perceived, it goes to the lymph node, the body produces its antibodies or the things to fight the infection. The lymph node may swell in response, but then may collapse as the body does a better job of fighting. Sometimes the lymph node gets overwhelmed with the infection, gets big, gets swollen, and may end up actually forming an abscess as well. These are all things that can potentially occur, and you have to realize that antibiotics are only going to treat bacterial infection or fungal infection, not viral infections. But the lymph node's basic job is to take information about things that are foreign, allow the body to process it, and to fight it, and to hopefully get you better.
But a lymph node is something that an enlarged lymph node is something that you watch.
Yes.
Either you or with the help of a doctor.
Correct. If the lymph node's enlarged, like you're feeling fine, you have a swollen lymph node that persists over 6 weeks, that's something that may require a needle biopsy, which we can do in our office under ultrasound guidance, or may require other sorts of intervention like some blood tests in order to figure out what potentially could be causing it.
Good.
Now, another problem that frequently comes up a lot of times in children is tonsils. When is the right time, if there is any time, to have tonsils removed? And what are your specific recommendations?
Well, let's take a step back. Similar to lymph nodes being lymph tissue that processes, things that are going on, tonsils are also lymph tissue. Basically what it does is it perceives the environment and things get processed in them. It's part of also the adenoids or the lingual tonsils, and the pharyngeal tonsils are just part of it as well. All these things are, as you're swallowing things, it takes little bits and pieces of it and processes it. The reason to remove tonsils would be is if you're getting recurrent infections from it, or you have infections that spread outside the tonsil, and that's called a peritonsillar abscess or cellulitis. The tonsil gets so enlarged with the infection, it spreads to the outside and may require some type of needle or surgical intervention. If you have more than one of those, your tonsils probably should be removed.
Let me ask you a specific question.
Yes.
Tonsils need to be removed if they're recurrent infections.
Correct.
What do you mean by recurrent infection? Every 2 months, every 3 months? Once?
Okay. In children, the guidelines are if you have more than basically 6 to 7 infections in one specific year, if you have 2 years in a row where you have between 4 and 5 infections, or if you have more than 3 infections a year for 3 years in a row, then you should probably consider speaking to an otolaryngologist about removing the tonsils. Yeah. If you have a complication related to a strep throat, which includes some type of kidney infection or heart infection, you may want to consider getting the tonsils removed sooner. In adults, it really gets to the point of how problematic are these tonsils, and are they causing you to miss significant portions of work? So if you're having 2 infections and you're out for 3 to 4 weeks, we would consider removing your tonsils at that point. if you're having things that are infecting your functioning, like some people get stones in the tonsils called tonsillitis. When they fall out, they smell, and it's a cause of bad breath as well. In those patients that have pain and persistence of these tonsillitis that don't respond to traditional treatments, that's another reason to consider removing them.
One of the laws in medicine is that you should take your tonsils out as a child because it's much more painful as an adult.
That's true.
Okay.
But that is absolutely true. The patients who have it when they're older have more pain, but the question is when do the problems arise?
Right, right. Yeah.
If the kid's not having problems when they're a child, but has problems when they're adult, then that's appropriate.
Yeah.
If you've had chronic tonsillar problems for a long time, it's better to get it done as a child because it can be quite painful when you're an adult.
Yeah, okay.
Now, what about the medications that you and your staff use in terms of the treatment process? Do they vary across the board? What types of things are used for what purpose?
As far as with otolaryngologists, we treat infections with either antibiotics or antifungal.
Right.
These are different type of antibiotics depending on what bug is growing. For viral infections, we usually give supportive therapy like Tylenol, pain medicines, hydration, other things like that. For swelling, sometimes we give steroids or other anti-inflammatory agents. For patients who have too much mucus, we may give things that thin the mucus. We may treat with allergy. Even our patients coming in with headache or quote-unquote sinus, some of these patients have migraine. So we end up using migraine medications on these patients as well. The good thing about being an otolaryngologist is you have a large arsenal to choose from. You have the medical treatment, you have the surgical treatment, you have different therapeutics you can do as well.
Tell me about the fungal infections.
More and more, we end up seeing a lot of fungal infections of the ear. There's patients, if you are immunocompromised, you can have you can have thrush or whitish infections of the throat. You can also have it going down into the esophagus and larynx. There's a couple of times, ENT physicians have thought that they almost see a tumor and then they treat it with the fungal infection and they end up getting better. So even things that may look bad may actually be better or they're infectious in nature. But
well, you provoke some discussion. You have a caller. Rosa, you're on the air. You have a question for this good doctor?
Yes, I do. If you have like a bump behind your ear or a bump under your chin, and you recently had a cold, but the bumps, the lumps or bumps, whatever you want to call them, didn't go away, should you go get that checked out, or is it just going to disappear by itself?
How long have you had the lump and bump?
2 weeks.
2 weeks at this point. It's still kind of early. Remember I was talking about the early infection and if you're feeling fine now, you can probably wait out to 6 weeks and see if it goes away. That's most likely, I can't say for certain, but it's usually a lymph node that's responsive to the infection. Remember I talked about how it fights the infection and gets swollen and then will shrink down with time. So if it's just continue to monitor it. If it stays large, there's no problem for you to go see a doctor about it, but you're still kind of early in the stage, and I would consider just monitoring it. It's obviously something you can feel, and you can feel if it's getting bigger or smaller. If it continues to get bigger, then I'd say consider having something done. And, if it persists, let's say it gets to 6 weeks or 5 weeks, and you still have it, the worst thing that could happen is you come to the office, we do an ultrasound, we measure it. If it's above a certain size, we would just put a small needle under the ultrasound to take some of the tissue to help you figure out what it would be. But at this point, it sounds like it's within normal.
Okay, thank you, Rosa. We have another call. Palm, you're on the air.
Hi, I wanted to find out, please, which of the gland is more important in your body? The parathyroid or the thyroid?
Well, both are important. The thyroid is basically involved with metabolism and keeping you warm. The parathyroid's involved with calcium, basically keeping that salt in your bones and creating the level between your bones, your kidney, and everything else. The thyroid itself also has some functioning as far as calcium as well. It produces a protein called calcitonin. Parathyroids produce a hormone called parathyroid hormone, and then the thyroid also produces some hormones, different type of thyroid hormones as well.
Okay, but if you have a parathyroid that was taken out, should I be taking supplements, calcium supplements?
You could be, but there are 4 parathyroid glands, and sometimes 5 and sometimes 6. So if you've had one removed because you had a parathyroid adenoma, a lot of times you're okay. I mean, to be honest, as we advance in age, we end up giving calcium supplements anyway, and sometimes bisphosphonates or different types of medications to strengthen the bones. So taking calcium in conjunction with your doctor is fine.
Okay.
But
all righty, thank you.
You're welcome.
Okay, thank you.
Okay, well, let's now pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
Bronx Lebanon surgeons are experts in the field, bringing a diversity of skills and cutting-edge operative procedures to their patients.
But what is most important about our Bronx Lebanon surgeons is that they are responding to many difficult challenges and saving lives.
Nurses at Bronx Lebanon are also an integral part of the OR team.
We work with the surgeons in the operating and recovery rooms and are at the patient's bedside providing the necessary support and compassionate care.
In the ICU, our critical care specialists evaluate, treat, and monitor patients until they're strong enough to be transferred to a med-surg floor.
Sometimes surgical measures are necessary to breathe life back into patients, and ear, nose, and throat surgeons are called into action. Bronx Lebanon's oral and maxillofacial specialists are widely acknowledged for their expertise in all types of dental surgery.
From tooth extractions under intravenous sedation, the emergency treatment of facial injuries, to innovative implant procedures, we are clearly placing smiles for miles in the Bronx.
Bronx Lebanon is also leading the way in cardiology, dermatology, internal medicine, infectious diseases, neonatology, nephrology, neurology, pediatrics, family medicine, pathology, psychiatry, and radiology. And its Bronx Care Network, including a soon-to-be-completed ambulatory care facility, is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. Dr. Yakovlevich, what do we mean when we say someone is having a thyroid problem?
Well, it can be many different things. It can be as simple as a cyst or a fluid that accumulates in the thyroid. It can be it being too big, too little, functioning too much, which would be considered hyperthyroid, functioning too little, which would be considered hypothyroid. And then there can be different cancers, from the most treatable form of cancer to probably one of the most deadly form of cancers we have in the body. All can be residing within the thyroid as well. So basically, and thyroids also can cause problems as far as shortness of breath, difficulty swallowing, just because they get so big that they actually can compress the structures that are directly behind it, which include the voice box, or the trachea, which is the windpipe, and then the esophagus, which is the food pipe.
Okay. Well, we talked a little bit about the parathyroid before, but we talked about numbers and different things. What's the function of the parathyroid, really? We sort of mentioned it, but could you...
The parathyroid's basic function is to make sure that the proper level of calcium is in the bone, in the body, in the blood, and get excreted out the kidney. So calcium's important as far as it's kind of the salts in our bones. So if the calcium levels become too low, there's a chance that we can have broken bones. And so those patients who have adenomas or growths of their parathyroid,
but if they become too high?
If they become too high, then the bones can have the calcium taken out of them. They leach into the blood to keep up the level that its set point is. And then the bones become weak and brittle, and you can be more prone to breaks. So the reason...
So it's important to not to ignore problems with the calcium.
Right, and calcium usually is part of the routine test that your doctor will get as far as what the chemistry is of the blood. And if it's elevated, they may do additional testing to find out why is it elevated.
And it can be the cause of kidney stones also sometimes.
It can be cause of kidney stones. It can have some psychological implications. It can basically have, the patients can have chronic pain related to problems with the parathyroids as well.
Okay.
And how does diet influence this? Is there any type of prevention that can...
As far as with parathyroids, they haven't really found a diet that may be associated with it.
Right.
Patients with kidney failure can have elevated calciums, and they actually, all 4 of their glands can become hyperactive. Right. There are some, genetic predisposition as far as with hyperparathyroidism. It means too much activity of the parathyroids. But as far as with anything else, as far as diet and everything else, there hasn't been too much link to it.
Okay.
And then on the horizon now, if we were to remove your thyroid, there is perfect replacement in Synthroid or these different medications.
Right.
With parathyroid, if it's taken out too much, right now there's no good replacement, but actually in Europe and soon in the United States, there will be a replacement for parathyroid hormone.
Right. Now, a question we frequently ask our panelists is to share their respective success stories with our viewers. And I'm sure in your area, you've had many. Can you share a few of them with our viewers now?
Yeah, no, we've had some patients referred from, upstate, out of state. I had one 3-year-old with a large tumor in the jaw and everything else that he keeps coming back. He's like 7 or 8 at this point. A tumor that all the nerves that move the face were kind of around the tumor.
Right.
And we were able to get it out. His face moves completely normally and has been completely healed. This is now 4 or 5 years later. We've had we had a pregnant woman who we discovered a thyroid cancer during her pregnancy. The baby was born. We cured her thyroid cancer as well.
That's terrific.
And, every day it's another success story we have with our patients at Bronx, Lebanon. It's really a wonderful, marriage between the community and the doctors where we just provide their needs and we take care of them.
Right.
We had one patient who just came in, had unable to breathe. We had to do an emergency procedure called the tracheotomy to get them to breathe. Through our colleagues in radiation chemotherapy, we were able to remove his tracheotomy tube. He's able to talk, breathe, swallow well, and he's on the way to being cured.
Yeah. Okay, let's light it up a little bit here. On a more controversial note, what about the question of oral sex? Is it a problem for you or for the patient sometimes?
Let's take a different tact with that one. Oral sex, any sex, there are...
controversial.
Exactly.
But you know what I mean.
No, I totally know what you mean.
Yeah.
So the thing is what we don't realize is human papillomavirus, or the wart virus, can cause these whitish growths in different parts. It causes warts. But the other thing that it does is it actually can change our DNA. So there's 2 different types, HPV 16 and 18. And there's the new vaccine called Gardasil.
Well, I'm going to ask about that.
Okay,
afterwards.
I'm sorry.
Yeah,
so HPV 16 and 18 can actually cause changes in genes that prevent cancer, or they can actually overact certain genes that are involved in cancer production. So if you have those exposures, you can. It's actually now we look for it in every single head and neck cancer that we remove to see if HPV has affected it. And now the majority of head and neck cancers have changes related to the wart virus.
And that is why the Gardasil is coming in now as a therapy for men also.
Correct.
Right?
Correct.
You want to elaborate?
Because basically Gardasil, or it's actually, I think, between HPV 6, 11, 16, and 18. There's 4 different subtypes of the wart virus that this will vaccinate you against. So this means that these cancer-changing or DNA-changing viruses will not affect areas in the throat, which can, like the tonsil or the base of the tongue, which people who've never smoked or drink, because that's the traditional reason why people get head and neck cancer, we're finding more and more of these cancers that are unrelated to smoking, drinking, and they're related to actual HPV exposure, which we believe is caused by oral genital contact.
Yeah. Right. So there are 3 doses for men also, and at what age?
Usually it's usually 10 or 12 that they can start doing it before you become sexually active in order to do it. And it actually, for men, it'll also protect their partner because pap smears are basically looking for, HPV or changes in the female genital areas. We don't have any type of thing to do that for the mouth, but really these type of contacts can cause these viruses, which can cause cancer, to be spread all throughout the orodigestive genital areas.
Right. Now, how do individuals in our community gain access to your service? And then I wanted to ask you a follow-up question to that as well.
Either through 99 Bronx, they can be referred from their primary doctor. We take 99% of the insurances we take. And the thing is that our office's number, 718-901-6901 or 518-5659. You call, you make an appointment. We have multiple different locations that we practice out of, including 3rd Avenue and 1276 Fulton.
Right. What I wanted to ask you before is, why do individuals at times lose their voice? And is there anything that any of us can do about it?
Well, certain reasons that people lose their voice is they may be angry at someone or scream, and they can have temporary swelling. Infections can cause it. Nodules can cause it as well. Basically, if you're talking poorly, you can actually cause like a callus or growth on your hand to form on your voice box as well. Obviously, cancers can grow on the voice as well, on the voice box as well. And if you have persistent hoarseness, that's a reason to end up seeing a ENT doctor. Also, lung infections can end up causing problems with the voice, because you have to realize that in order to produce a voice, you need strong lungs or strong breath support. And if your lungs, through some type of infection, weakness, smoking, are not strong, you're not going to have the energy to produce a strong voice.
Okay. Do you see any progress in your division? Not, I don't mean at hospital. I mean in ENT.
In the field.
In the field.
In the field, we're doing much better, doing more things without being as invasive. So basically the treatments are going through the nose, through the mouth, and everything else to try and do things without causing any additional cuts and doing what the necessary.
On that note, let me thank you, Dr. Yakubowicz, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for joining with us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night. See you next week.